Say ha. No, ha. Make sound.
Ah.
Ha. Okay, bite. Okay, so they have already done UP4, as we say, and the uvula is not there and it's moving reasonably well, so we don't have to do that anymore. I'll be only working on your jaws. Now, what you have to understand is that we should be able to solve your problem, right? Your sleep apnea problem. And there will be a change in the way you look. Now, you already 34 years, I mean, you will change a lot the way you look.
Yeah.
The reason being, see, there's less airway behind your upper and the lower jaws. Now, some patients, what happens, they don't have a very proportional face on the outside and on the inside as well. So what happens when I correct on the inside, the outside looks even better. So they look like even more handsome, or their aesthetic appearance gets better. In your case, the inside is pretty bad. There's no airway visible here if I see. But in the outside, it doesn't show the gravity of the problem that you're having inside. Meaning external aesthetics is not a direct indication of your internal physiology, anatomy, whatever. So what will happen, I would be able to correct all of this, but the concomitant change that will happen in your facial-maxillary skeleton may not upgrade you aesthetically.
Okay. Yeah.
That's something you have to understand, yeah? So this is the scan. Now here is your airway, okay? My finger is the airway, right? So it goes through the nose, you can see. Goes through the nose, behind your upper jaw, behind your lower jaw, and onto your lungs.
Right.
Behind this is another tube that goes for your eating.
Okay.
That's the thing, that's we're not concerned about. So what I'm saying here, so see how it is. I will be making the cut here between your nose, working on the center part of your nose, which is the septum, going backward on this jaw, and cutting this and moving it forward a little bit, maybe 3, 4, 5 mm, that we'll plan. But at the same time, tipping it. When you tip like this, see the angulation.
Got it.
So it really opens up the airway.
Got it.
So that's the kind of thing we're going to do with the upper jaw. Lower jaw, see, your bite is good. So I don't plan to change your bite.
Okay.
Your bite is going to be the way it is right now.
Okay.
Your chewing efficiency will not decrease. It will be status quo. We'll maintain your bite. Hence, in order to maintain your bite, if this is tipped down, this jaw also has to be moved.
Okay.
But this jaw has 2 joints.
Okay.
Hence, I have to consider that and do the movement.
Okay.
Then move the chin separately.
Okay.
Right? So those are the 3-fold movements, actually 4-fold movements that you will have in your facial-maxillary skeleton.
Okay.
The upper jaw will move forward physically a bit. It will go counterclockwise a bit. Lower jaw, since a condyle position, I don't want to change, because if I change this, you may have problems with your TMJ, you may have other issues developing in the future. This will be the same. Hence, I will change the rest of it to match your bite, and then a big genioplasty also. Good morning and namaste. We're going to start with this very challenging surgery for today. It's going to be a bite job with a genioplasty, but the reason is not for any aesthetics. It's for function. So this gentleman has a very severe sleep apnea, which we call as OSA because it's obstructive sleep apnea. He's been diagnosed of this, I think 3 years ago, was it? He's had a surgery before abroad. They've done a UP3 or UP4, as we call it, where the uvula, the pharynx, or the throat has been operated upon, soft tissue work done. He doesn't have much improvement with that. He's also continuously on CPAP machine. Am I right?
Right.
And so we've done a scan for him, and we've seen that his entire facial-maxillary skeleton is obstructing his airway, literally. His AHI index is 90 on the polysomnography or the sleep study, which is like really, really high. It's a very, very severe kind of an issue that he's having. These kind of severe obstructive sleep apneas not only have problems on the day-to-day living, but also can get patients other issues with relation to heart, strokes, and so many things. Now, what we've planned for him today is bringing the upper jaw forward by about 5 millimeters. We're going to do a counterclockwise rotation, so it's going to rotate backwards. which means we're going to get gap behind the upper jaw. So the objective is give him more space to breathe behind his nose, between his nose and the septum. So we're going to be doing septoplasty behind his upper jaw. So it's going to come forward and also tip in this way. So there's more airway, and also similar work on the lower jaw. Yet we're going to give him a good bite, the same bite that he's got. So we're not changing his bite. Plus genioplasty to get the muscles of the tongue and the associated structures forward so the airway is better. So we've just completed here with a major bimaxillary surgery with more than 20 millimeters advancement at the sagittal region, another 18 millimeters at the chin. And we're going to show you the upper jaw. You can see now we've advanced the upper jaw. We've also done a counterclockwise rotation. We're going to do some suctioning and show you the posterior aspect. You can see the plate there. So this was a surgery that we've done for obstructive sleep apnea, maxillary advancement, maxillary counterclockwise movement, mandibular advancement at the sagittal region, and also at the chin region, all in one go.
Here we have with us Karthik patient. He is a operated case of bijaw surgery. Yesterday we did a bijaw surgery for him. He had an obstructive sleep apnea. That is a condition in which the lower jaw is very backwardly placed. So because of very backwardly placed lower jaw, he had breathing interruption during sleep. So we have brought both his jaw, maxilla as well as mandible forward, and also done the genioplasty for him to give him a aesthetic and a better appearance. As you can see, today is the first post-operative day of the patient, and there we can see very minimal of swelling. There would be swelling for at least 10-15 days. Okay, so it will gradually go. No need to worry for that. Okay, rest we are giving him the antibiotics and painkillers for the pain control. Okay, so no need to worry, everything is fine.
So this is a patient who had obstructive sleep apnea, and we did very radical maxillary and mandibular advancement and counterclockwise rotation. His facial profile has now become anterior divergent. So we were just talking about his meal habits. So currently the patient is on soft liquid. So he should be compensating for the fact that he's not having any solid food by incorporating high calorie liquid intake, protein powder, a lot of fruit juices, non-veg soups if you are someone who eats non-veg. That way the protein and the mineral requirements for the healing will also be taken care of. His intraoral healing has been pretty good, and this phase has a very, as you can see, it's very different from what he initially started with. We'll be doing a repeat sleep study a couple of months after the surgery. A surgical edema will take around 2-3 months to settle down entirely. After that, we'll do a sleep study again to actually objectively see. Maybe a couple of days later from today, we'll also take a scan, so we can see on the scan how much improvement is there in the airway. After that, like once the edema subsides, then we'll take one more scan and a sleep study, so you'll objectively know from 90 how much forward we have come. All right.
You have swelling now as of now, so it takes some time to, it will gradually decrease. Okay, you can see your results of 70% in a month, and it takes, like, for complete results it takes 3 months of time. Okay, and yeah. Are you feeling any better now after the surgery?
Yes, that's for 2 hours. That never happened.
Oh.
That is up to 3 minutes.
Nice.
Without the mask, it's really hard. No, it's just
So now you're sleeping better after the surgery.
1 hour, 2 hours.
Okay.
Not today, but
Mm.
last year, 1 hour, 2 hours.
Mm.
I feel the tongue portion is up. upward alert.
Mm.
I was not choking at all.
Nice. So before it used to choke and.
So,
and
every
you-
3 minutes, I choke.
Oh. Okay, now it's
The
better.
mask doesn't fit,
Hmm.
the day is falling.
Like you can't sleep at all.
The weather changes every area.
Hmm.
Every
Hmm.
3 hours, 4 hours.
Hmm.
Mask,
Nose
wear the pressure.
block. Hmm. Now it's better, right?
Now it's
It will get more better gradually. Okay, don't worry. No complaints, right? Are you drinking juices or everything, right? Just take at least 2 to 2.5 liters every day so that you'll recover faster. Even we're giving antibiotics, right? Though they are like high dose antibiotics. If you eat better, drink better, then you'll recover better.
Open the bit more. Where is it paining? Bit more. 1 second. Can you open a little bit more? So we'll keep doing this every day or every other day, and then maybe wait for another few more days before you're good to go home.
Yes.
And but once we remove everything, your mouth opening will increase.
Okay.
Because it's all, we're applying pressure from outside.
Okay.
Plus the jaws are all in new position, and we moved it like way forwards and downwards and rotated and many things. But everything is okay.
Okay.
The scan's fine. There is no surprising thing. All the screws are good. Everything is perfect. And so we will wait for 2 more days, 3 more days max. Then you can leave. Again, we'll call you after 2 weeks or something. Pending local venue.
Yeah, I think.
So you can come and then that will be fine.